Good afternoon, everybody. Welcome to today's community conversation. People are still joining, so we're just going to give a couple minutes for people to get online. We've got over 100 folks registered for today's webinar, so expecting a really good turnout. We're just going to make sure everybody has a little bit of time here to get connected.
Recording in progress.
Okay, it looks like everybody who was in the waiting room has joined us now. Can you mute those? Thanks. I'm still hearing echo from your computer. You can just watch on mine. Okay. Sorry, everybody. Thank you so much for joining us today for today's community conversation in honor of Elder Abuse Awareness and Prevention Month. We are happy to co-promote today's event with the New Jersey Advocates for Aging Well. And I am here today with their executive director, Kathy Rowe, who will be introducing today's speaker and moderating today's presentation. However, before we begin, just a couple of housekeeping rules. So you are aware, this workshop is being recorded, and we will be making the recording of this presentation available on the NASW New Jersey YouTube channel after the event. And for everybody that registered, we will also be sending out a link to the recording as well as the presenters' resources from today. I also just want to remind you that you did sign a code of conduct when you registered for this meeting, and we just ask that you remember this is a public forum and that you refrain from using the chat for any self-advertising or for posting any rude or inappropriate comments. If you could just refrain from that, we'd appreciate it. And with that said, I'm very happy to turn things over to Kathy Rowe, Executive Director of New Jersey Advocates for Aging Well, to get us started today. Thanks so much for joining with us in this project, Kathy.
Thank you. And thank you, Jeff, for inviting us to join you. So this is the third time in only about 6 or 7 months that I've had the pleasure of having Peter speak on our behalf. It's a wonderful way of being engaging and connecting, and which just shows the concern and understanding he has of his clients. Peter is a social worker at Jewish Family Service of Central New Jersey. He received a master's in social work studying mental health and social economic development at Washington University in St. Louis. He currently serves as the coordinator of Project CEASE, and that stands for Combating Elder Abuse Through Supportive Services and Education at Jewish Family Service of Central New Jersey in Elizabeth. And that program serves residents throughout Union County. So as I said, I've had Peter speak several times. A very important project he's involved with is the PCTI program through Rutgers Dental School, and recordings of both our Aging Insights and a webinar on that topic can be found on our website, NJAAW.org. I encourage you to check it out. It's just one more great program that Peter is involved with supporting older adults. So with that, I will stop embarrassing him and turn this over to Peter. Thank you, Peter.
Not at all, Kathy. It's always a pleasure to partner with you and the New Jersey Advocates on Aging Well, as well as Jeff and the whole team there at NASW New Jersey. I want to thank everybody for joining us on this day, World Elder Abuse Awareness Day. What better day to talk about elder justice than today? I will share my screen so we could get started here. All right, everybody could see that presentation. All right, excellent. Again, my name is Peter Jacob. I'm a social worker at Jewish Family Service of Central New Jersey. We serve all of Union County here, providing various services, counseling, home care, transportation, Meals on Wheels, and so forth, a variety of services. And we established this program, Project CEASE, and CEASE came out of our older adult department, seeing that there was a great need among older adults, individuals 60 and older, to address this issue of elder abuse and justice. And it came about through a conversation, a collaboration between Jewish Family Service of Central New Jersey here in Union County and the Jewish Federation of Greater Metro West to educate people in the community, professionals and older adults alike, about the preventative methods, how you could identify and provide supportive services and interventions when such abuse does occur. And I just want to inform folks that we are funded by the Jewish Community Foundation and Jewish Federation of Greater Metro West. So, Project Cease, what do we do? First and foremost, we provide community education, what we're doing here today. It is the understanding and the philosophy that if we educate the community about the risk factors and signs of elder abuse, people, if they know to recognize something, they're more likely to say something. So if you build it, they will come type of approach. And when we are able to identify it in the community alongside partners, they end up making referrals to us. We, as a program, provide case management, counseling, mental health interventions, all kinds of supportive services for those who have experienced abuse and families. We provide home care for the elderly to provide a form of respite for caregivers and themselves. Access to other services provided by Jewish Family Services, such as in-home nursing consultations, certified home health aides, transportation, kosher meals on wheels. We do referrals to legal counseling or shelter when and if necessary, and linkages to other community resources such as home repairs, meals, and other type of things in addition. So what is elder abuse? Take a moment for yourself and think about how you would define elder abuse. And I bring this up because unlike child abuse and domestic violence we see, which has pretty clear-cut definitions, most people have challenges in understanding what is elder abuse because it is not on our radar. And I had a lot of difficulty finding one all-encompassing good definition, unlike the other major forms of abuse, which, duly so get their recognition. However, we need to shine a spotlight on elder abuse, which we're not doing. We need to put it on the radar. And the best definition I could find comes from the U.S. Department of Health and Human Services, which defines elder abuse as any knowing, intentional, or negligent act by a caregiver or any person that causes harm or serious risk of harm to a vulnerable adult. And here's some quick facts to really put this on the radar for us. The fact of the matter is about 1 in 10 Americans aged 60 and older have experienced some form of abuse. That's over 5 million cases of elder abuse that we know of happens annually. And there's data to suggest there are more cases of elder abuse than there are child abuse and domestic violence cases. But similarly to those forms of abuse, only 1 in 14 cases are ever reported. Older women are more likely than men to experience abuse. Nearly 60% of abuse is often committed by a family member. Abuse of older residents by other residents in long-term care facilities more common than physical abuse by staff. It's the case that, when we put on the 9 o'clock news, we hear about a nurse or an administrator in a long-term care facility who's abusing a patient in a long-term care facility, but often, and think about how more common it is between residents themselves and how often it goes unreported or not addressed at all. Abused and neglected older adults are twice as likely to be hospitalized and die at a rate 3 times faster than older adults who haven't experienced abuse. This, folks, is a public health crisis indeed. And elder financial exploitation is estimated to be upwards of $37 billion in losses annually. Just think to yourself how many of these calls, these robocalls you get, these scam calls that you're getting, whether it's extending your car warranty or somebody pretending to be part of Social Security or Medicare. And once upon a time, we had a greater sense of pre-contractual solidarity in our community where you trust the guy coming around selling you that encyclopedia or a new type of lawnmower or whatever it is. So nowadays with phones and stuff, Scammers have found all kinds of ways to take advantage of people who may not otherwise be able to recognize these forms of abuse. And that is why we do the work that we do. And again, why we need this issue on the radar. The fact of the matter is there are more Americans 65 and older than at any other point in global history, but right here at home in the US as well. The census in 2010 indicated that there were 40.3 million people aged 65 and older. And at that point, they estimated that by 2050, that number of 40 million will double to 80 million. The most latest stats that I could find state that in 2019, 54 million people are of that range. So that number is climbing faster than we expect. And at some point, all of us here, if not already, will be an older adult if all else goes right in the world. And so if we don't address this crisis now, it will lead into something similar to as we see with other endemics or pandemics. So we need to nip this right now. And the way we do that is creating awareness, creating the programs. And so this is why we talk about this issue. And I hope this is something you could share with your colleagues, friends, family, and neighbors. Having learned those quick facts, here are the major forms of abuse. Physical abuse is perhaps one of the most popular forms of abuse. When people think about elder abuse, they think about perhaps physical abuse, inflicting or threatening to physically pain or injure a vulnerable elder. Emotional or psychological abuse, inflicting mental pain, anguish, or distress on an elder person through verbal or nonverbal acts. Sexual abuse is any non-consensual sexual contact of any kind, even without physical touching. For example, pictures without somebody's consent and so forth. Financial exploitation, illegal taking, misuse, withholding, or concealment of funds, property, or assets of a vulnerable elder. That is very common as well. That probably also comes to mind when we talk about elder abuse with all the scams and schemes that we're hearing, especially amidst the pandemic. Neglect is the refusal or failure by those responsible to provide food, shelter, healthcare, or protection for a vulnerable elder. Then we have self-neglect, an elderly person that threatens their own health or safety and generally manifests itself by failure to provide themselves with adequate food, water, clothing, shelter, personal hygiene, medication to take it when they're capable, and ensuring safety precautions. Believe it or not, most people perhaps do not think of self-neglect, but if you're in the field practicing with older adults, in fact, the leading cause, according to AARP, of elder abuse is self-neglect. You know, when we see somebody cut themselves, we see it as self-harm. In the same way, an older adult who has the capability for whatever reason do not meet their own needs, it's self-neglect. We see this increasingly rising nationally and even I could say anecdotally, especially in the form of hoarding, for example. And then you have abandonment, which is the desertion of a vulnerable elder by anyone who has assumed the responsibility to care or have custody of that person. Abandonment is just a more severe form of neglect. So how do older adults tell us? Here are some things to pay attention to, some flags and things that they may bring up where we should ask some more questions. They may say to us, no one talks to me. My children make decisions without telling me. People call me names. And then she, he, they hit me. I am scared. I don't like my aide, nurse, or caregiver. I don't understand what happened to my money. Some of these, especially the last two, perhaps are very common. Something to keep in mind, though, is for you, to do your due diligence and do some investigation and ask follow-up questions. Tell me more about that. What's going on for you? What kind of care would you prefer to have in your life? And it's important to be mindful because sometimes racism is a factor here. Dementia is a factor here. It's important to get the story from them. So when these red flags do pop up, don't dismiss it as, oh, it's just dementia. Sometimes there may be something further down the rabbit hole. So it's worthy to have continued conversation and explore some of these questions. So here are some signs of elder abuse. Obviously with physical abuse, perhaps the most obvious to recognize in the form of abrasions, lacerations, bruises, fractures, burns, use of restraints. The manifestation of physical abuse includes depression, delirium with or without worsening of dementia or dementia-related behavioral problems. Emotional, psychological abuse, if you directly observe verbal abuse, verbal attacks, belittling, bullying, talking to an elder as though they are a child, even though they have the capacity to understand fully. Isolating them from activities, stalking them, strained or tense relationships between the older adult and a caregiver, subtle signs of intimidation, for example, deferring questions to a caregiver or potential abuser when you recognize they have full mental capacity to answer. You know, if you're a physician or a social worker, somebody working one-on-one, and you see that they competently answer everything, but when it comes to some things, or maybe all things, when you ask some deeper questions, they tend to defer the questions to somebody else, looking to them. Isolation, again, from previous activities, friends, manifestation of depression and anxiety. Sexual abuse, bruising, abrasions, lacerations in the anogenital area or abdomen, newly acquired STDs, especially in nursing home residents with cluster breakouts, and UTIs, urinary tract infections, are all potential signs of sexual abuse. Financial exploitation. You know, to recognize this, sudden changes in somebody's financial situation. Once upon a time, they're able to pay for their medications, healthcare, transportation, mortgage, rent, utility services, medical appointments start falling off, worsening of their medical conditions happen, they don't take their medication, malnutrition, increasingly where you're unable to explain weight loss, poor financial decision-making, firing of a home care provider or any other service providers are all signs of this. I will share a quick story with you, or I'll try to make it quick. One of the first cases I've had here at Jewish Family Service was literally somebody who lived down the block from my parents' house here in Union County, about 2 blocks over. And I didn't know the individual, of course, but we got a referral from the Division on Aging informing us that an individual, older gentleman, almost 70, let's call him Sam. Sam was at home, going to be left home alone by himself, as his whole family was going to pack up and move out west to Nevada, leaving him behind. And he has several health concerns. And so I show up on a Tuesday afternoon. I go up and meet Sam in his bedroom. He's laying there. I see he has several medications there. He is an amputee from one of his knees down due to an infection. He explained the situation and said, actually, the timetable is moved up. His wife, his son with his wife, but his wife was previously married and had a daughter living with him, her 3 children, and her husband. And her daughter was not working, nor was the husband, but they were living in the house. And the home wasn't in the best condition. And so I often see my clients on a weekly or as needed basis. And so I decided to visit Sam 2 days later based on the urgency of the situation, as the family was going to be leaving soon. So I show up at around 10 a.m. on a Thursday morning. I knock on the door, knowing that Sam needs to put on his prosthetic leg. I give him some time. I try to call him on the phone. He doesn't answer. So I give about 5-10 minutes. I knock on the door a few times, just say, hey, Sam, I'm here downstairs, so that he could potentially hear me. Some kids answered the door, the stepdaughter's kids. Mind you, it is a school day, but I'm not here to address the kids. I'm here to address Sam, and he hasn't answered the door. So I go up, knock on his bedroom door, which is closed. I let him know I'm coming in. Sam is on the floor. He's not very responsive to when I ask, are you okay? Do you need help? Did you take your medication? To everything that I asked, Sam faintly responds, I made a mistake. I made a mistake. So I then pull out my cell phone, call 911. I know he takes some pain medication and such. I know that there is other health concerns with him. So by the time I get to the bottom door, the EMTs are there. Sam's blood sugar was so low that he could have potentially gone into a diabetic coma and passed away. I just happened to be in the right place at the right time. I come to notice some other things, such as jars of stuff sitting by, and I presume that they were jars he used to dispose of his needles that he uses for his insulin. But it looked like there were liquid in it. Sam reported to me that the water wasn't working in the house, that the water was shut off in the house, and he would just take those containers and just dump it out into the toilet when he was done. So there's a public health concern. So I do contact the building department, noticing some other issues with the house. They contacted the health department because there were kids involved, and eventually we had to call DCP&P because having the water off is a health concern, especially with kids in the home. DCP&P decided to take Sam's stepdaughter, husband, and kids and let them stay at a hotel till things were sorted out. We were able to get back the water, and in talking to Sam, I came to realize that he had a decent pension from his time as a teacher. They have a decent social security together with his wife, but money was running out real quick. I came to learn that the house was refinanced as well, and it was going into foreclosure. And looking at their finances, I noticed that there were expenses that clearly he was not paying for, and the stepdaughter was taking advantage of him. And so we addressed those concerns. We changed their bank numbers and credit cards and debit cards and got everything reissued for them. We connected them with an attorney. Fortunately, one of their cousins out of state is an attorney, but was able to assist. We were able to get home care into Sam's house, and his son and wife stayed behind. His stepdaughter and family left for Nevada, and he was much more happier with the home care in place, with the services in place. Instead of staying up in his room, he'd come down and spend time with the family, watching TV. We were taking him to his doctor's appointments. He was receiving Meals on Wheels from us, and he started doing a lot better. We were able to address the foreclosure issue, get cash for the keys, which is a program that gives you money for your house. And they were able to move to an apartment that was more friendly to them, that they could get into, and they did not need as much space as they did in the home. And so Sam, his son, his wife did pass away a couple of months ago, but they're doing well. And they're always happy when I'm calling them and connecting them. And so that's one story of the services we were able to provide. And mind you, again, this happened blocks from my parents' house. This is not happening in New York or somewhere else. This is happening in our own backyards. And without these services, those folks would go under the radar, and who knows what would have happened had we not been there to address those various needs, not just the abuse, but the case management, providing the mental health services. So to move on to other signs of abuse: neglect and abandonment, failing to provide food, water, medical care, taking the older adult to the toilet when they need to go, ensuring the home is safe and clean, addressing the older adult, paying for bills, or leaving the older adult alone for long periods of time are all examples of neglect and abandonment. So we know that at times older adults don't report. And why don't they report? Sometimes they may be reluctant to report abuse themselves due to lack of physical and/or cognitive ability to report, fear of retaliation from the person doing the abusing, or because they don't want to get the abuser in trouble. Again, we have a society where we don't know what happens when elder abuse happens. Where do we report? Is everybody going to get in trouble? And the assumption is that most, older adults would think that the police is going to come, lock away my caregiver, and then I'm going to be alone. And most older adults, even if they're experiencing abuse, rather be in their home than in a situation that they are unfamiliar with in reality. And we know abuse happens on a spectrum. So They rather prefer their current situation to the unexpected. And that is because they don't know the services that are in place and how we may go about addressing it, which we'll get to in a moment. So if you do come across abuse, and when it comes to child abuse or domestic violence, folks know that there are shelters. People know of DCP&P, or what used to be DIFUS, so they know there's child protective services. And for domestic violence, there are some shelters and opportunities for individuals to be protected and be safe. However, when it comes to elder abuse, people don't know where to go. Here in Union County, we have Jewish Family Services, Service of Central New Jersey, so you can contact us there. I'll put our contact again towards the end. We have APS, Adult Protective Services. Every county throughout the country is sanctioned to have an APS. That's the main number for every county has one here, also in the state of New Jersey, but that is the main contact number that you could call to find out the office in your county. When it comes to abuse in long-term care facilities such as assisted living or nursing home, institutional type of abuse, there is the county ombudsman's office. Every county has one throughout the county as well. And that's the New Jersey State Ombudsman's office number. But typically, especially after hours, abuse just doesn't happen 9 to 5 when all these offices are open. We know that it happens throughout the day. And also a good first line of response is calling 911. And there's also a national hotline available here listed. Again, I will share these numbers towards the end. And you'll get a copy of this information as well.
Peter, hi, it's Jeff. If I could
Yes.
just interrupt for 1 second. Can you go back
Yes.
to the slide?
Yes.
The information that you posted, the phone numbers there, are those statewide? Because I know you had mentioned county offices particularly.
Yes, those are, I left it statewide. When I'm in Union County, I leave our number and the local APS number, but that is statewide numbers. Yes.
Okay,
So you can contact
anybody
them
in
and
New
they'll refer
Jersey,
you. Yep.
anybody in New Jersey can use those numbers.
Yes, correct.
Thanks.
And I'll share this PowerPoint with you, Jeff, for anybody who asks, who wants this information, you can make it available to them.
Excellent. Thanks so much, Peter.
Yep, thank you. Okay, and so now that you know where to report, something to keep in mind. We as social workers, we're mandatory reporters when it comes to this. So are police, firefighters, paramedics, medical professionals, but but other folks making a report have a right to confidentiality of their identity. We as mandatory reporters, because we're making the report, don't so much, but we all have a right to protection from civil and criminal liability, as well as any professional disciplinary action, including protection against retaliation by an employer, protection for providing information, records, or services related to a report of suspected mistreatment. That being said, again, I want to come to the point that we understand elder abuse happens on a spectrum, and we take into account what's happening socioeconomically and politically in our nation. And so we want to address this issue, keeping in mind the fact that 80% of Americans are living paycheck to paycheck. Nearly 2/3 of Americans cannot afford a $500 emergency, which is usually medical. I mean, if you look at GoFundMe, the overwhelming majority of it is medically related. And 1 in 8 or 40 million Americans are experiencing some form of food insecurity. That number may be greater now. And take those facts and connect it to what I'm about to tell you next. The typical caregiver is a 46-year-old woman with at least some college education. Think about what the average 46-year-old woman is doing: raising kids, likely working, taking kids to soccer practice, their medical appointments, doing grocery shopping, laundry, stuff around the house, cooking, all the typical things that society puts upon women that they do. And on top of that, they're taking care of an older adult. In a 24-hour day where you need to do all these things, where is there time for yourself? So caregivers have higher levels of depressive symptoms, clinical depression and anxiety than the general population. Women caregivers of older adults with dementia and caregivers of functionally impaired older adults appear to be at higher risk of all these things. And over 1/3 of family and informal caregivers reported being in fair to poor health or having a serious health condition themselves. This is no surprise. So that being said, we like to stabilize a crisis situation using the least intrusive methods. Granted, we see, severe forms of abuse, we will make those referrals for shelter. We will call 911 if we see that. But often, like I said, it happens on a spectrum, and we, like evidence-based suggests, want to keep the family together, want to provide them with the resources necessary for them to be healthy and have the right choices to remove as much stress as we can from their lives. So we provide in-home nursing consultations, certified home health aides, transportation to medical appointments, Meals on Wheels, Uniper, which is an online program for older adults. It's designed for older adults in mind. Shameless plug, if you're interested in that program, please reach out. If you're in Union County, that is. But we're also happy to provide the information. It is designed for older adults and has various live and pre-recorded activities. And we provide the case management, counseling, and linkages to other services when required. So that's kind of the micro level what we do. At the macro level, we have a response in having seen this and working in partnership with the Division on Aging in our county and the prosecutor's office, who addresses more financial crimes, as well as with APS, legal services, and so forth. We've constructed a multidisciplinary team, a elder justice task force here in Union County, to bring all of us together, because there's various perspectives and skill sets and sanctions that each of these institutions have in addressing. So as a social worker, we bring a valued perspective, because many of the prosecutor's office folks may not know how to do the social services, how to communicate with individuals. And as Kathy mentioned earlier, we have a PCTI philosophy, a person-centered trauma-informed care philosophy. And sharing that really helps, because law enforcement is notorious for going out and re-traumatizing or re-triggering individuals who are already in a crisis situation. So that kind of communication and sharing of knowledge and working together to address this, the old saying, adage goes, it takes a village, and that's the philosophy we bring here to address elder abuse here in Union County. And you, at an individual, those of us in the elder justice community know that social isolation is one of the greatest risk factors for elder abuse. We cannot let one catastrophe create other crises. So stay connected, phoning older adults, checking in on an older neighbor, writing a card or a letter can all be positive steps, ensuring public safety and social justice for all of us. So everyone is responsible to ensure elder justice. It is our community. Creating a just society includes treating older people as equal members and making sure we are all connected to our communities as we age, so that we can prevent and address elder abuse. I have the philosophy here, just to conclude, we often treat older adults as these objects to care for. Rather, we should see them as individuals to empower. And so that is the philosophy we take, so that we could strengthen our older adult community. That learning, me as an older adult social worker, it's not just me showing up as the clinician and the expert and telling them what to do and what they need. It is a two-way street. It is a dialogue between us to not just enrich that one-on-one relationship, but create that sense of empowerment among older adults in our community. That being said, thank you so much for joining this important slideshow on this important issue on addressing elder abuse and ensuring elder justice. Happy to continue the dialogue with all of you, Jeff and Kathy.
Peter.
Thank you, Peter.
Go ahead,
Can I
Kathy.
go back to that slide with that information if you want, or we could stop sharing. It's up to you.
Let's stop sharing so people can all see each other. And then if you want to go ahead and email me those slides, I will send them out after this webinar is over. I've also got some information that I will share with you all about Project Cease that Peter sent me. And I'll share the websites for New Jersey Advocates for Aging Well and Jewish Family Metro West as well. If there's anything else you want me to share, Peter, you can just send it to me in an email with the slides.
Great.
Kathy, did you want to enter into some Q&A or any follow-up questions?
Yeah, I would
Peter?
love to do that. I'd like to start off with a question from one of your first slides, Peter, when you were talking about the types of abuse and the signs, you know, including neglect. What I wonder is, does the abuse or neglect have to be with intent? Because there are families have very different dynamics. And if that's what seems normal for that family, it just seems abuse from my perspective. So can you elaborate on that when it's, you know, what is a family dynamic that is abuse? And how does intent play a role in the definition and doing something with abuse?
Excellent question, Kathy. I think it ultimately depends on the outcome and the result. Is it producing harm? And at some point, you know, even in our personal lives, people use a lot of humor and are sarcastic with folks outside of elder abuse. And at some point, it just gets redundant and it's just harmful. And when we go into a situation, we kind of assess the whole family dynamic. Sometimes it takes time for people to be willing to join the conversation or for us to be able to address some things. Because I'll go into a situation, for example, and sit there with the individual, and the person causing the harm or the abuse is in the next room. They don't want to address it. They don't want to be held accountable. But they see me often enough where at some point I feel comfortable inviting them to a conversation. And then when they're willing to join, we address some of the ways we communicate with each other. You know, we talk about PCTI and how the guiding principles in PCTI, you know, ensuring that people have this sense of collaboration with each other. And you can't collaborate with each other if everything that you're saying is sarcastic or comes from a place lacking empathy or compassion. And so we do acknowledge, like, okay, you know, you could be funny at times, you could be playful with each other, but there are some serious matters, like mom is in a place where she needs compassion and love and empathy at this time. You know, the humor is fine and she could entertain it, but she's really hurting and we need to kind of be mindful of what we're saying and be more supportive at this time. So that's the way I approach it with families.
Thank you so much, Peter. I see we have somebody, Luann has your hand up. Did you want to unmute, Luann, and ask Peter a question?
Hi, Peter. So that was really helpful information. I'm noticing maybe an unintended form of abuse that came from the pandemic is isolation and loneliness. And I'm seeing that in the senior population that we serve, where family members have literally fallen off the face of the earth in assisting their loved ones, and trying to re-engage them has been really difficult. And I'm wondering if anybody else has experienced some of that, or is there any, you know, what comes with isolation and loneliness in that population is also some paranoia or some feelings of distrust. And so trying to re-engage them into the world of, you know, getting services has been a challenge. So I'm just wondering if there's any strategies or anything that anybody else has used around that, because I'm seeing that.
I'd be happy to hear from others. I think it's an excellent point, Luann. And I'll also add that isolation and loneliness was already an issue. And then the pandemic put it on steroids. And I think some of it, to go back to Kathy's use of the word unintentional, a lot of it was not intentional because we wanted to keep a safe distance. Folks were older folks are more vulnerable to the pandemic, so people didn't know where they're at. But that became more of a status quo. And then, you know, you fall off seeing somebody and then you stop talking to them, then you don't see them, you don't see grandma, grandpa as much, or you're not in touch with them. One thing that we did is, as an agency, almost immediately, we established what I had mentioned, the Uniper program. And through Uniper, you could have a camera. You could either use it through a tablet or a laptop or desktop, but we have an actual device we come and install, and with that device is a camera, and they're able to see, and it's all HIPAA compliant. They're able to see and connect with family members and a caseworker. So at least if it's not a physical interaction, they could see each other virtually. And often seniors get the bad rep of being not so tech savvy. It's true that there's a fear of technology, but once they're shown, it might take a little training and practice, it does reduce it. I'd also add that a society that does not value our older adults, is fundamentally a concern in a system that values children because they could produce later and work in the factories and so forth. And that's the way we've designed our education, and people who are working now produce in society. Whereas older adults, whether that's intentional or unintentional from public policy perspective, we don't value their lives. And that is why we're falling so far behind when it comes to providing home care services, and we're knocking down our senior centers and building these, luxury condos and all that stuff. So we need a society that empowers older adults, not just sees them as just these objects.
Thanks, Peter. I see a couple other hands. I know Andrea had her hand up. Are you all set, Andrea, or did you still want to speak?
Yeah, no, I'm good. Thank you, Peter. Excellent presentation. I was just thinking in my years as being a therapist that sometimes it's just helpful to have compassion for even the abuser, the caretaker, if they are neglectful. And so I see two issues going on, is that they're under increasingly more strain because of COVID. And then there's the guilt about not visiting. And so then they avoid the older adult because, quote unquote, they don't want to infect them. But I think a lot of it's just avoidance and anxiety. And, families are just very overwhelmed. So I just wanted to say that one of the things that I think is helpful is to provide services to the caretaker to avoid that, escalation of hopelessness. Just wanted to add that. Thank you.
Yep, and I'll just comment on what Andrea said. A lot of the research that's done, to reduce elder abuse comes through providing services to the caregivers who are often stressed.
Thanks, Peter. Padma, I see you've had your hand up. Would you like to unmute?
Yeah, I think I have a little bit of a complicated question. It is little towards the cultural aspect as well. I think some of the, in some culture, like especially like if you take like Asian culture or some other cultures, right? People often think if you are older, and then after a certain age, especially when it comes to making decisions in terms of like medical expenses and things like that, they tend to think if you cannot afford, if it is very expensive, they tend to make a decision for you, right? Do you need this surgery, which is going to cost more? Can we put aside this money for certain other expenses? Or like, how do you make that decision? It can be considered as an abuse, right? It can also fall into that category. And what do you, and also older people tend to think, right? I had lived enough for so many years. Do I really need this hip surgery? Or can this money be spent elsewhere? Or what do I need to do? So this is a complicated question, but have you ever come across certain situations like that? And how have you handled some of those situations?
Padma, I love complicated questions, so I appreciate it. And I assume from your name, we have the same cultural background. So I identify with some of the things that you're saying. I'd say this, I think it is a cultural, it is cultural for many people. I see it also among people throughout the United States because of the cost of healthcare and not wanting to be a burden on their children or others. Like, oh, I hear it all the time from my older adults, like, oh, my children have grandchildren and they're busy with their lives, so I don't want to bother them. They have their lives. They want to kind of be out of the way. But I'll say this, the response I have, and I think it's a cultural response that we need, a socio-cultural evolution in the way that we're thinking about older adults. like I said, there's more older adults now than any other point in human history. Thanks to advancements in modern medicine, people are living longer. And therefore, we need to shift our thinking to acknowledging that older adults are humans and they need healthcare as well. You know, we shouldn't be denying healthcare. We shouldn't be cutting Medicare. In fact, we should be investing further into healthcare for older adults because your life is short. You know, so you should not be living in pain and suffering. You could be living if you forego that hip surgery. And I have 3 clients in my time here at JFS whose lives were transformed by a hip replacement surgery. They are up and dancing and moving. Oh my God, they seem so happy. And I remember how miserable they were during COVID when there was delays due to that. And then they were able to get their surgeries and whole new attitude in person. So I think as a society, we need to shift our thinking, and that comes with a conversation. And so I urge you to speak to that older adult, that you tell them like, look, times have changed. People are living longer. You deserve a good quality of life. So the healthcare is out there. You could get it. Don't stress about, putting pressure on anybody else. You know, you're going to be happier potentially for another 20, 30 years of your life, if you get this surgery rather than suffering for months and ruining your health.
And Peter, I want to add, I'm not disagreeing, but one of the other areas that we focus on, we work with Goals of the Goals of Care Coalition in New Jersey. And yesterday, one of we had a panel of speakers on, understanding what matters to your patient. On the flip side, there are families that are pushing for medical treatment that the parents don't want. So I think their motto is nothing less than the care you need, nothing more than the care you want. For example, a 95-year-old with a cancer recurrence, do they want to spend a year on chemotherapy? They might say, they might decline and say, I don't want to go through that, where the children might say, we have to do this, we need to. So these are important conversations to have on both sides, getting the care that you do need and will improve your life, but also not being forced to have care and having your family listen to you and respect your decisions. So like a hip replacement, yes, that makes a world of difference on your mobility, on your quality of life, but something that might prolong life 6 months, 1 year, that's something that the older adult has to make and not have their kids force something because they're afraid of losing them.
Absolutely.
And a great website on that is Goals of Care, I think it's Goals of Care NJ.org, but they have a lot of good information on that. So not correcting you, but just adding to it.
I 100% agree. Yeah, we need that conversation. It's sometimes a quality of life question. And one of the principles of social work is self-determination. So
Yeah.
Absolutely. Yep.
Thank you both. This has been a great discussion. I do see a couple of more hands, but before we get to those, I wanted to just attend to a couple of chats. Alicia says it's a very informative presentation. She's just curious, what would you say are some of the more surprising or unnoticed signs of elder abuse you've encountered?
I'd say, I didn't get into this, I'll be honest, as I didn't get into the profession of social work thinking I'd be working with older adults. I got into social work, a lot of my work that I did prior is around human trafficking and addressing that issue. And so once I graduated social work school and I came back to New Jersey, even my homeless clients were older adults. And one thing, once I started this work, there's a lot of surprising things almost at every client that you're meeting, but something I'm finding very common is hoarding is a major issue. And that is connected to self-neglect. It's not that people want to live in the cluttered situation. It's that they may have physical or mental trauma that they've dealt with. On the surface of hoarding is the clutter and the things that we see physically manifest. But underneath the surface is the anxiety and the depression and the trauma that they've dealt with. I had a client who experienced a fire in the 70s. And since then, it's been difficult for her to let go of things. And so I think hoarding is, especially, people are living longer. We're a consumer economy and we tend to consume a lot of stuff. We tend to hold on to that stuff for sentimental or otherwise. So I think alongside addressing, the physical or financial abuse and, preventing all that stuff, we need to really tackle the issue of hoarding and really understand it and have a lot of empathy and patience in addressing that sect of elder abuse, self-neglect.
Thanks again, Peter. That's such a really good point about hoarding and that being a sign. It's not usually one that people would think of. See, Elizabeth, you had your hand up and you had a comment in the chat. Did you want to unmute, Elizabeth M?
Well, I can. I mean, it's the same comment. For one thing, the DCP&P office in my area has several hundred employees. The Adult Protective Service office has 6.
Yep.
And I had called at one point in time. I was aware of a situation where I am very fearful that an elder person is possibly not receiving proper care. There are mental health issues among the caretakers. And I was basically informed that unless the senior is going to accept, identify, reach out for help, there's like very little that can be done. The caretakers are very resistant to having any help come into the house. And it was actually kind of identified that unless it's a real obvious imminent danger, even if you know that someone is functioning at only about 25%, there's almost nothing that can be done. And you know that someone who's living in a home being cared for by family, they're going to be very hesitant to go against that family. These are the people who are caring for them. And I mean, you were wonderful. You were able to go in and really negotiate the system. If we don't have an agency with skilled people and access, how do we begin to address the hidden elements, the hidden situations that are out there, or even when you have a sense, almost, what do we do?
Yeah, I think that's an excellent point. I think you hit the nail right on its head when you show the disparity between child abuse and how much attention we duly give it, and it deserves that attention. But when we see the data and we know that, or based on the data, we know there's more elder abuse cases than there are potentially child abuse cases, but it's not addressed. So yeah, funding is a huge issue for APS. I feel for them that they're highly understaffed and they could only, focus on certain things. I always advise people to reach out if they're hitting like a wall with it, to contact their local division on aging, see what organizations are in your county. For us, it's, I'd go out and do the work, but it is very challenging if the families don't let you in. I think that's what, as a task force, we need to develop policies on how we go about addressing it. Because when it does come to child abuse, and I don't presume it always has to come to this, but if it's child abuse, the police work with the social worker, with DCP&P, and then they go out and address the situation. I can't tell you if that's the healthiest way to address a situation yet. I don't want to, jump to any conclusions here, but I think other agencies need to kind of circumvent the avenues that APS takes and perhaps more informally contact the family and say, hey, the Division on Aging reached out to us. We do X, Y, and Z. Could they help out with meals? Just getting your foot into the door with, say, Meals on Wheels or some small thing. Home care once a week for 2 hours, whatever it is, so that they see that they're receiving some type of benefit, and they see, okay, there is something in the community to help me out. These 2 hours a week gives me some kind of respite. Maybe there's some other things I could benefit from. So, trying to get our foot in the door more informally, as opposed to going in and, just doing all kinds of things that people presume you do and that they'd end up in trouble for, is perhaps a better avenue, if that makes sense. It's very difficult to answer because we don't have an institutional force necessarily to address elder abuse as well as other forms.
Thanks again, Peter, for your thoughtful and insightful responses. I know Anise M at one point had a hand up. I don't see it anymore, but Anise, did you have a comment? We've got about 5 minutes left.
Yes, I see that you have programs in place for people, families and caregivers and nursing home residents, but I'm concerned about an advocate program for seniors living in community-based housing experiencing physical abuse from community housing management and staff. In this situation, Adult Protective Services was called, but maybe it's because they're short-staffed. I did call them, but they never called back to see how things worked out. The police got involved and some other things, but I made calls to all the different resources. And I really didn't get much assistance during this pandemic. And like I said, they have advocacy for people in nursing home residents, but what about the seniors living in the communities that are isolated? I happen to be a more active senior, but there's some that's frail. And if I was physically abused in the apartment building where I live, what about the ones that are not as mobile as I am and vocal as I am? I'm really concerned about that. Now, the Jewish Community Services is an excellent agency. They provide nutrition and mobile pantry in this community. And I'm so appreciative of what Peter Jacobs, brought forth. It was very educational. And I was referred to Jewish Family Services, and I think I will go on and make that appointment to see if I can get some sort of assistance, because they usually, one resource refers you to another resource, and then basically you're on your own.
Yeah. Anissa, I just want to be mindful of time. I know people probably have meetings after this. We have like 2 minutes left here. Thank you for sharing. I'll let you know that, are you in Union County?
No, I'm not. I'm
Okay.
in Mercer.
Okay. Yeah, I'm not sure about the services down in Mercer, but if you contact the Division on Aging there, I think that's the first response. Just Google Mercer County NJ Division on Aging or Office on Aging. They may be able to guide you better. But our program does, go into some of the senior buildings and stuff and address some of these issues if it does arise.
Thank you.
Yeah, so they should do it. I know. Yeah, again, APS is highly under-resourced, but yeah, we do, our program does go in and address people generally in the community who are not in long-term care facilities. Thank you.
Okay, well, thank you so much, Peter, and thank you, everyone. We are getting close to being out of time. Peter, I don't know if you want to go ahead and drop your email address in the chat so people have that.
Yes, I could go ahead and do that.
And then I can send that again. And then also just a couple of announcements before we wrap up. Kathy, is there anything you wanted to share on behalf of NJAAW?
No, I'm so glad that you asked us to join you in this. We encourage all of you to sign up for our website. For our newsletter, I'm gonna put our newsletter and website in the chat. And Jeff, I really hope that we partner on more things to bring this important information to people. Thank you.
Yeah, I would love that. Thank you for joining with us and for helping us find Peter to give this presentation, Kathy. Really, really appreciated.
Peter, I'll give you a little of a break now. I won't bother
Yeah.
you for a few weeks at least.
A few weeks, don't make it any longer.
Okay.
Just a little bit more information. Peter had mentioned the Goals of Care Coalition earlier today. NASW New Jersey is also a member of the Goals of Care Coalition. And in conjunction with them, we offer an advanced care planning certificate program for people who work with elders. And if that's something that you are interested in, the next convening of that certificate program is in October. It begins October 18th. It's a 10 CEU program. And I will include a link to that information in the follow-up email that I send out. Also, if you're interested, just a few other programs that we have coming up this summer, free programs that you may be interested in. Next Monday, we are doing a program on the global refugee crisis and social work with refugees in honor of Refugee Awareness Month. And then in July, we will be having a community conversation about disabilities etiquette and working with individuals with disabilities. I don't believe that's on our calendar yet, but it should be soon. And then later in July, we are having a presentation with Somerset County Department of Human Services about their Community Police Alliance that they've established in Bridgewater. And then a little bit of fun, late July, July 27th, we're having a community conversation about the benefits of animal-assisted social work. Your therapy dog will see you now. And then those of you who are NASW members, our next free CEU program for NASW members is July 28th. It's called See My Color, Why Racial Color Blindness is Unethical. And you can find information about all of those programs on our calendar at NASW-NJ.org, and then just click events. But thank you again, everybody for being here today. Really thank you all for attending. Participation was great, attendance was great, and thanks again, Kathy and Peter, for the presentation. Keep your eyes open. Hopefully by the end of the day, if not today, tomorrow, I will be able to send out all the follow-up from this event. Thanks everyone, and we'll see you at our next program. Take care, everybody. Bye.
Bye, everybody.